and this is unit 6. So in the anatomy of hind limb and pelvis, so hind limb already completed. Then pelvis. Pelvis means the pelvic cavity. So there are some organs of urinary system, male genital system and female genital system, which are located into the pelvic cavity. So I have to cover it. So there are usually three systems are present in the pelvic cavity. There is urinary system, male genital system, and the female genital system. In the urinary system, the organs of the urinary system are the kidney. Then kidney are connected with the ureter because there are two kidney in the body, that is right kidney and the left kidney. Then from each kidney there is emergence of one ureter, and this ureter is connected to the urinary bladder. And from the urinary bladder there is origin of one urethra, and urethra is common passage for the urinary system and the male genital system. It is common opening means. So the kidney and the ureter, the part of the kidney and the ureter, the kidneys are located into the abdominal cavity. Okay. And part of the ureter is also located into the abdominal cavity. So this kidney, these kidneys and the ureter, it will be covered by the teacher who is going to teach you about the abdominal cavity. So urinary system consists of four components, that is two kidneys, right and left kidney, then one ureter, then there is one urinary bladder, and urinary bladder continues with urethra. That is common opening for the male genital system and the male means genital system and the urinary system. So I will start from the urinary bladder and I will cover the urethra. So these two organs are located into the pelvic cavity. So urinary bladder, just a minute, I will share the PPT. Yeah, I am sharing.
Sir, slides are not visible.
Yeah, I am sharing. Just wait. Now I think it is visible. Okay. So as I already told you that in the urinary system, that is urinary system, in the urinary system there are four components. Number one is the kidney. Okay. These kidneys are two. One is the right kidney and one is the left kidney. Then second component of urinary system is the ureter. So from each kidney there is emergence of one ureter, and these two ureters, they are communicated with the urinary bladder. That is the urinary bladder, and from the urinary bladder there is one passage, that is single, that opens external to the body. So kidneys are two, ureter are two, urinary bladder is single and urethra is single. So first is urinary bladder, and urinary bladder, this urinary bladder is musculomembranous sac. It is sac-like structure, and it has also ability to stretch. Actually it is musculomembranous sac and differs in form and size. Position according to the amount of its content. Amount of its content means urine. If it is contracted means when there is no presence of the urine, so it is in the form of dense pyriform mass. It is in the form of dense pyriform mass and lies on the ventral wall of the pelvic cavity. Ventral wall means, suppose this wall is the pelvic cavity. So you can say that this is the dorsal wall and this is the ventral wall of the. So there is presence of the urinary bladder, and when it is contracted, it is dense pyriform mass and lies on the ventral wall of the pelvic cavity. And when it is moderately full, it is oval. When the urine is present in the urinary bladder, it is oval in shape. It is oval in shape. So due to the amount of the urine into it, the position may be varies. So it is oval in shape and extends into the abdominal floor. Extends into the abdominal floor, and the capacity of the urinary bladder in case of the ox is 3 to 4 liter. 3 to 4 liter. So in different animals, the capacity may be varies. Then you can see here, these are the contents of the body cavity. So here you can see this is the thoracic cavity. In the thoracic cavity, there is presence of the lungs and the heart, and this whole is the abdominal cavity. So in the abdominal cavity, you will find major organ of the digestive system, that is part of the esophagus. Then there will be presence of the stomach, that is rumen, reticulum, omasum, abomasum. Then there will be presence of the intestine. There will be presence of the liver, spleen, gallbladder. These are the major component of the abdominal cavity. And along with these organs, there is presence of the kidneys also. So there will be on the either side of the body, there will be right and left kidney. And from each kidney, there is passage of the ureter. So ureter will be also part of the abdominal cavity. Then the behind the abdominal cavity, this part is the pelvic cavity, and this pelvic cavity usually consists of the male and female genital organs, along with the part of the urinary system. In this part of the urinary system, you will find the urinary bladder along with the urethra. So these are the contents of the body cavities. Then what are the different parts of the urinary bladder? Actually, urinary bladder consists of 3 parts. It consists of a vertex, a body, and a neck. Vertex, a body, and a neck. Okay. So this whole is of the body of the bladder. You can see, and there is a vertex. So this part is called as vertex, and here you will find the neck of the urinary bladder. So neck of the urinary bladder, body of the urinary bladder, and the vertex of the urinary bladder. So it consists of 3 parts, and you can also see that it can be also, you can classify as a cranial part, middle part, and the caudal part. So here, if you will see in this diagram, so this side will be cranial, this side will be caudal. So this is cranial, this is caudal. Okay, so this part is cranial, this part is the caudal, and this whole part is the middle part. Okay, so first is the cranial part. So this part is also called as vertex and is a blind end and presents in its middle a round cul-de-sac. It is called as cicatrix. Means you can see here, just a minute, I will remove it, this card changes. Yeah. So you can see here, so first part is this is the cranial part. So in the cranial part, this is also called as vertex, and in its middle, it present a depression that is called as cul-de-sac, or also called as cicatrix. Means here in the middle of it, there is presence of a depression that is called as cul-de-sac or the cicatrix. So first part of the urinary bladder is the cranial part, or it is also called as vertex or vertex. Then second part, it is the middle part, or it is also called as body, and it is rounded and somewhat flattened from above downwards. It presents 2 surfaces, the superior and the inferior, which are convex when the urinary bladder is full. So you can see here, this whole is the body of the urinary bladder, and it consists of 2 parts. This part is called as superior part, and this part is called as inferior part. And these 2 parts are convex when there is presence of the urine, when it is in the form of when it is in the oval form. Okay, and you can see here also that I already told you there are 2 kidneys, that is right kidney and the left kidney, and from the kidney there are presence of the 2 ureters, and these ureters, they are going to be open. They are going to be open just in front of the body or caudally to the body at the neck of the urinary bladder, that is caudal part. Okay, so third part is the caudal part of the urinary bladder, and this is a narrow extremity. This is a narrow extremity, and it joins the urethra. It joins the urethra here. It joins the urethra by openings. There will be opening inside here. Okay, there is opening inside here. So these openings are called as internal urethral orifices. These openings are called as internal urethral orifices. Internal urethral, just a minute, urethral orifices. Orifices means opening, orifices. So the part of the ureter that is going to be open over the neck of the urinary bladder or the caudal part of the urinary bladder, that is called as internal urethral orifices. So the urinary bladder, it consists of three parts, as a cranial part, caudal part, and the middle part. So from the caudal part is also called as vertex, and it bears in its middle, that is called as cul-de-sac or the cicatrix. The middle part of the urinary bladder is called as body of the urinary bladder, and the cranial part where the ureter is going to be open is called as neck of the urinary bladder, and the opening of the ureter into the urinary bladder at the neck is called as internal urethral orifices. So these are the three parts of the urinary bladder. Then what are the different relations of the urinary bladder? Relations of the urinary bladder means what are the different organs which are present above or below to the urinary bladder. This is very, very important. So if you will draw one urinary bladder here like this, so this is called as dorsal part of the urinary bladder or superior, or this is called as ventral part of the urinary bladder or the inferior part. So the dorsal surface in the case of the male, it is related to the rectum, means in case of the male there is presence of the rectum just dorsally to the urinary bladder. The genital folds and the terminal part of the vas deferens and seminal vesicle and prostate gland. So these are the organs which are present dorsal to the urinary bladder in case of the male. These are the rectum. Rectum is the terminal portion of the intestine. Then there is genital fold. Then there is terminal part of the vas deferens, the seminal vesicles, and the prostate gland. In case of the female, it is related to the body of the uterus and the vagina. These two are the female genital organs which are present dorsally to the urinary bladder. And the ventral surface of the urinary bladder in case of the male or female, they are related to the floor of the pelvis, because this whole part is usually covered by the floor of the pelvis. So this part, the ventral part of the urinary bladder, it is related to the floor of the pelvis. Then you can see here in the diagrammatic representation, you can see this is the in case of the male, this is the urinary bladder. So dorsally it is related to the rectum. Then there is prostate gland, and ventrally it is related to the floor of the pelvic cavity. In case of the female, if you will look out here, there is body of the uterus. There is body of the uterus, and along with the body of the uterus, there is some part of the vagina also, which is present dorsal to the urinary bladder. And ventrally, in case of the females also, it is related to the pelvic floor. Then what are the different ligaments which are present into the urinary bladder? This is very, very important. There are several ligaments that is related to the urinary bladder. So these ligaments are there are usually two ligaments. So what are the function of these ligaments is to fix the urinary bladder in its position. So to fix the ligament in its to fix the urinary bladder in its position, there are three peritoneal folds. Peritoneal fold. Peritoneum is the covering of the organs of abdominal cavity and its abdominal and pelvic cavity along with its viscera. So the peritoneal fold is present into the abdominal cavity and the pelvic cavity, and it covers the organs of the abdominal and the pelvic cavity, which remains the organs of the abdominal cavity and pelvic cavity in its position. To make the organs in its position, there is presence of ligament on various organs. So there are three peritoneal coverings. So first one is the ventral. Ventral means, suppose this is the urinary bladder. So there is presence of the ligament here. So the ventral or the middle ligament is a median triangular fold, extends from the ventral surface. So this is the ventral surface of the urinary bladder. So it extends from the ventral surface of the bladder to the floor of the pelvis or abdomen, like this, because there will be floor of the pelvis or abdomen. So it usually connect the ventral surface of the urinary bladder to the floor of the pelvic cavity or abdominal cavity. Then next is, there are two lateral ligaments. These lateral ligaments are two, and these lateral ligaments are present on the either side of the right and left side of the urinary bladder and extend on the either side of the lateral aspect of the urinary bladder, and it connects the lateral aspect of the urinary bladder to the lateral wall of the pelvic cavity. Means these two ligaments, they are connected to the lateral wall of the pelvic cavity, and each contain in its free edge a round cord that is called as round ligament, which is a remnant of the fetal umbilical artery. This is very, very important. The round ligament is a remnant of the fetal umbilical artery. Umbilical artery usually carries the deoxygenated blood into the fetus. When I will go in the embryology, then I will explain about it. So these are the three peritoneal fold. Two are the lateral and one is the ventral. And the caudal part of the bladder has no peritoneal covering. Caudal part means the vertex part, and it attaches to the surrounding part of the fat and connective tissue. So there are three peritoneal covering. Two are lateral and one is the ventral. Then what are the differences in the different species? As I already told you, in case of the ox, so there are some differences, few differences in case of the horse, pig, dog and fowl. So in case of the horse, it is shorter but wider. It does not extend into the abdomen as forward as in case of the ox. Means it completely lies in case of the pelvic cavity. In case of the pig, it is relatively very large. When it is full, it is in the abdominal cavity. This is very, very important. In case of the ox, it may be in the pelvic cavity, it may be in some part in the abdominal cavity. In case of the horse, in case of the horse, it is completely in the pelvic cavity. But in case of the pig, when it is full, it moves from the pelvic cavity into the abdominal cavity. In case of the dog, when it is empty, it is pelvic in position, and when it is full, it is entirely abdominal in the position. Means the position of the dog and pig urinary bladder is almost similar. In case of the fowl, very, very important. In case of the fowl, there is absence of the urinary bladder. There is no urinary bladder. So the two ureters which are arising from the kidney, they usually opens into the urodium of the cloaca. Urodium of the cloaca. What is the urodium? What is the cloaca? I will teach you later on when I will cover the organs of the male and female genital system. Okay, so these are the very, very important and differentiating features in case of the different domestic animals. Out of these domestic animals, in case of the all, means ox, horse, pig and dog, there is presence of the urinary bladder, but On the basis of the urine, the position may be varies. It may be in the pelvic cavity or it may be in the abdominal cavity. But in case of the fowl, there is complete absence of the urinary bladder. Hence, the ureters opens into the urodium of the cloaca, and cloaca generally consists of three parts as a proctodium, urodium, and coprodium. So out of these three parts, that is proctodium, urodium, and coprodium, I will explain you later on. These two ureters which are coming from the kidney, they opens into the urodium of the cloaca. So this is completely about the urinary bladder. And the part of the urethra I will cover when I will go into the male and female genital system. So this is the urinary bladder you have to keep in mind. So come to the male genital organs. So I will give you only general description about the male genital organs. I will not going to start it today. Only I will give you a brief introduction about the male genital system. What are the different male genital systems and what are the functions of these male genital systems, and okay, so what are the different functions of the male genital system? So male genital system is usually it is for the production of the or formation of the spermatozoa, and spermatozoa is produced by the process of the spermatogenesis, and spermatogenesis is a process which occurs into the process which occurs into the testis. Okay, so testis are the main organ of the formation of the sperm by the process of spermatogenesis. So the main function of the male genital organ is to development. Development means the formation of the spermatozoa. Then there is also maturation of the spermatozoa. So this maturation is usually takes place in case of the epididymis. Then transportation. So transportation usually carried out by the vas deferens. That is also called as ductus deferens. You have already studied in the 12th standard, I think. And the deposition of the male gametes, that is spermatozoa, in the female genital tract, that is by the penis. So these are the different male genital organs. So you can see a testis. So testis is the main organ, or it is a gland that produces the spermatozoa by the process of spermatogenesis. Then second is the epididymis. When these spermatozoa are produced, these spermatozoa are usually stored into the epididymis for the process of the maturation. The maturation will be in case of the epididymis. The development will be in the testis. Then vas deferens. These vas deferens are usually for the transportation of the mature spermatozoa up to the penis. Okay, up to the penis. And penis is the organ of deposition of the spermatozoa in case of the female genital tract. Now there are some more. There is one more important thing is here in the male genital system is the accessory sex glands. So what is these accessory sex glands? These accessory sex glands are usually for the production of some important secretions that help the spermatozoa to survive more in the female genital tract, and these glands are also produce some like semen. So semen and that help the spermatozoa to more motile in the female genital tract. Also these secretions, they help the spermatozoa to survive for a long time. So you can see here, I will just give you this last diagrammatic representation, then I will start in the next class. So this is in case of the bull. You can see these are the different male genital organs in case of the bull. So I already told you that The first, that is gland, that is called as testis. So this testis is mainly for the development of the spermatozoa by the process of spermatogenesis. By the process of the spermatogenesis, the production of the spermatozoa is usually in case of the testis, and this testis is consist of three part that I will explain you later on. And this testis is connected with a, here you can see epididymis. So epididymis is connected with the testis. So the produced immature spermatozoa, they will come here in the epididymis and they will get mature. The maturity of the spermatozoa takes place in case of the epididymis. Number two. Then from the epididymis, the tail of the epididymis, there is presence of one duct. So this duct is called as ductus deferens or the vas deferens that connects the tail of the epididymis up to the, you can see here, up to the urethra here, urethra. So the main function of this vas deferens or ductus deferens is to transport the mature spermatozoa up to the urethra, and from the urethra, because urethra will be here, the last terminal opening of the urethra will be here, that will deposit the matured spermatozoa in the female genital tract. Okay, along with it, there are some accessory sex glands. So this is the number one, there is number two, and there is number three. So these glands are the seminal vesicles, bulbourethral gland, and the prostate gland. There are three accessory sex glands that secretes the some fluids to enhance the motility of the spermatozoa, to enhance their lifespan, and to maintain the pH and all. So these things I will discuss with you later when I will go with one by one content. And last part of the male genital system is the urethra, number 5. And this urethra is located inside to the penis. Okay, inside to the penis and between the two crura of the penis. So there is presence of the urethra. And this urethra is mainly, the function of the urethra is for the deposition of the spermatozoa in the female genital tract. So these are the different, you can see here, this is the testis, and the testis, it is covered by a skin, or it is covered by a scrotum, and that thing I will discuss you with the later on. So if you have any doubt in the urinary bladder and the general description of the male genital system, you can ask from me. The topic is open for discussion. Yes. Yeah, lateral ligament of the urinary bladder. I have to find some images. It's very, yeah, you just see here. So you can see here the lateral ureter. This is urinary bladder. Okay, clear? So from the both side, that is from the lateral part, there are two ligaments that connects the lateral wall of the pelvic cavity on the either side. Okay, lateral wall of the pelvic cavity. I will search some more photographs if there is. It is hard to find. On the either side, you have to just go through, you can find some more images over the Google. The structure will be like this only. This is urinary bladder, these two are the ureter. So one ligament will be present at the ventral surface and two ligaments which are originate from the lateral aspect of the urinary bladder like this, and they are attached to the lateral wall of the pelvis. Anything else?
So why will be the round ligament present?
Round ligament is a remnant only. Actually, it is present over the ventral aspect, and it is remnant only. That is actually I will show you in the fetal when I will go you with the embryology. So I will explain you in the that portion. Round ligament, urinary bladder. It's not clear actually. You can see, no, it's not visible here. Round ligament, I will have to mention ox. That photograph I will search and I will tell you in the when I am going to teach you the embryology. I will explain you about the umbilical artery, umbilical vein, how they are going to circulate the fetus, then what will happen when the newborn will come out, then what structures will remain, and there is some remnant. So I will explain you later on about this completely because here I am not getting the image of the round ligament. Anything you want to ask? I will explain you. I will search some images because it is very hard to teach online. I am somehow managing because when you are coming in the practical classes, the dissection and all, so you are able to things, okay? Because the third wave, you are also going through some news now. I don't think so. You are able to come this year to college. I think your first year will go just by online only. This is my personal view. So everyone, you have taken the vaccine.
Yes, sir.
Actually,
Yes, sir.
Yes, sir.
first dose to you have taken, na?
Yes, sir.
Yes, sir.
Don't go outside from the homes and all because this third wave will come within 1 month or 2 months. Because the public is crazy actually. They are coming out without mask and they are not following any protocols, like someone kept into the jail and they are coming out from the jail. The condition is like only. Okay, anything, leave it, that is different thing. You just ask about the urinary bladder and the male genital system. Leave it. Take care of yourself and yes, anything you want to ask, tell me.
Sir, could you please show the cicatrix again, sir?
Cicatrix, okay. Oh, just a minute. Cicatrix. Just look at out here. On the Google also, it is very, very hard to find the images. It is in books. Yes, you see. When you will see, you are able to see it?
Yes, sir.
Okay, just look at out this is the urinary bladder here, okay? So when you will look this portion from the cranial part, okay? So the cranial part looks like this, okay? So this part is called as cicatrix or the cul-de-sac. This is opening, but it is not internal to the urinary bladder. It is only a depression over the cranial part of the urinary bladder, okay? That is present over the vertex of the urinary bladder. Got my point?
Yes, sir.
Anything else?
Thank you, sir.
No question.
Okay.
In next class, I will start the male genital system, and in next 2 or 3 classes, I will complete this pelvis. Okay. And when your exam will come, then I will explain. I will tell you about the course. Up to where? Up to which portion you want to give exam? You tell me. Or you can tell me in next class after discussing among you. Okay. So I will give that portion only in the examination. Okay.
Okay, sir.
Okay, so you discuss in between you that you are comfortable with this part. So I will include that part in your examination. Okay.
Okay, sir.
Okay, thank you. Thank you.
Thank you.
Thank you, sir.
Thank you. Thank you. Thank you.
Thank you, sir.
Thank you so much.
Thank you, sir.